Hi, my name is Dr. David Kulla to discuss everything to do with anterior cruciate ligament or ACL ligament injuries. So today we're going to focus on phase 2 post ACL reconstruction or ACL repair surgery. Of course, we're going to give you exercises to rehab that knee. An anterior cruciate ligament tear is an injury to the knee that's commonly affecting athletes, but also non-athletes can experience an ACL tear due to injury or accident. We see about 100,000 ACL reconstructions performed per year in the US. And surprisingly, about 70% of ACL tears in sports are the result of non-contact injuries, and 30% are the result of direct contact, player to player, player to object, and women are more likely than men to experience an ACL tear. The ACL is a ligament located in the knee joint capsule. It's a strong fibrous material that connects bone to bone without blood supply of its own. It works to control excessive motion by limiting the mobility of a joint, of any joint. The ACL in particular, an ACL injury, is often seen in football, skiing, basketball, tennis, soccer, and any other sport involving a change in direction. Running. We see ACL tears in sports that require a quick change of acceleration to deceleration, forward to backward, whereas a sport that would require quick sudden side movements would more likely see in a medial collateral ligament or a lateral collateral ligament injury. Now, the ACL is the main restriction to forward motion of the tibia or shin bone. In other words, it stops the tibia from sliding too far forward, or when the foot is planted, the femur, the top leg bone above the knee, from sliding back. Now, the ACL is or contributes to not only stabilization of the angle of the knee, but also rotation of the knee joint. It anatomically crosses with another ligament in the knee, the posterior cruciate ligament called the PCL. Also having a relatively normal walking pattern. You want to make sure you're able to do that by the end of 2 weeks post-surgery. And then you also want to make sure you can get full extension in the knee, really straight. This is crucial. Not gaining full extension can have some drastic implications later on in the rehab process, so it's important to get that full extension. I tend not to stretch the hamstring too intensely in early stages, as most ACL grafts are taken from strands of the hamstring tendon on the same leg. So this needs some healing time as well. So having around 120 degrees of knee flexion or knee bend is good. And, flexion stretching exercises can hurt, but don't need to be pushed as hard when trying to gain full extension in the first 2 weeks post-operatively. Start to gain some good quadriceps, front thigh muscles, and hamstrings, back thigh muscles. Control, get both muscles firing together. Working towards having some single leg control. Keep in mind, these goals are for a straightforward ACL repair. There may be some different restrictions put in place if the knee has undergone some other procedures, such as a meniscal repair along with your ACL repair. Make sure to hit that subscribe button and give us a thumbs up if any of this was helpful to you. Thanks for tuning in.
Lie on your back with your legs straight out in front of you. Ensure you point your knees and toes directly up to the ceiling. Exhale and tighten your abdominal and pelvic floor muscles, stabilizing your trunk and your pelvis. Simultaneously slide one heel along the floor towards your buttock. Hold this position as you inhale. Exhale and slide the foot back down to the starting position. Make sure your knee continues to point directly up to the ceiling throughout this entire movement. Stand with the ball between a wall and your mid-back. Your feet should be placed in front and hips width apart. Keeping a straight back, tighten your core stability muscles and gently squat down, as far as you can go comfortably, by bending through your hips so that your knees do not pass in front of your toes. Tighten your buttock muscles to drive your movement back up to the start position. Your back should stay straight throughout this movement and your weight should be on your heels, not your toes. Stand facing a step. Place your affected leg up on the step. Step up, bringing your other leg onto the step, and then step back down to the start position using the same leg. Make sure your knee travels forwards over your toes during this exercise. Your affected leg will stay on the step throughout this exercise. Balance on your symptomatic leg for as long as you can. You may want to be close to a solid object to hold on to if needed. Do not rest your bent leg on the stance leg. Stand with one foot in front of the other. The toes of your back foot should just touch the heel of your front foot. Spread your weight evenly across both feet. Hold this position for as long as you can. Sit in a chair. Place your affected leg out in front of you. Straighten your knee, keeping your foot on the floor. Keeping your back straight, lean forwards from your hips until you feel a stretch down the back of the thigh. Hold and then relax. In a standing position, step your affected leg back behind you. Keep the heel on the floor and the toes pointing forwards. Bend the front knee, moving your body forwards, until you feel a stretch in the back of the calf. Make sure your heel does not come off the floor and your back knee does not bend. Please consult your practitioner for how long you can use the bike and at what interval.